You went through the consultations, the MRIs, and finally, the surgery. You were told it would fix your spinal stenosis for good. And for a while it worked. Then the burning and heaviness in your legs started coming back. The numbness returned. And now you're wondering, did I go through all of that for nothing? Research shows that 1 in 7 people, that's 15% of all back surgery patients, end up right back where they started, in chronic, persistent pain. But here's the secret the surgeons rarely mention. Just because the bone or disc was removed doesn't mean the reason for your stenosis was fixed. Today I'm revealing the 7 specific reasons why spinal stenosis pain returns after back surgery, including one structural change called adjacent segment degeneration that could be putting your neck spinal level at risk right now. Most importantly, I'm going to show you the 5-step strategy to stabilize your spine and finally get the relief that surgery promised but didn't deliver. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. A lot of people watching this were told the surgery itself was successful. The scans may even look better. That is exactly what makes this so frustrating, because you can still be in pain even when the surgery technically worked. One of the biggest frustrations I hear from patients is nobody explained why my symptoms came back. And the truth is, spinal stenosis pain after surgery usually does not come back for just one thing. In most cases, there are multiple mechanical, structural, and nerve-related problems happening underneath the surface. Some of them start months after surgery, some start immediately, and one of them can actually increase the stress on the spinal levels above and below your surgery without you even realizing it. So let's go through the 7 biggest reasons spinal stenosis pain returns after surgery, starting with one of the most overlooked causes I see in post-surgical patients: scar tissue formation around the nerves. A lot of patients are surprised when this happens because they assume the surgery fixed the problem permanently. The procedure may have created more space for the nerves, but the healing process itself can sometimes create a new source of irritation. Scar tissue is a normal part of the healing after back surgery. Your body creates it automatically. But in some post-surgical spinal stenosis patients, that tissue forms around the spinal nerves themselves. When that happens, the nerve can no longer move and glide normally during everyday movements. That's when symptoms like burning, numbness, tingling, and leg weakness start returning. One of the biggest frustrations I hear from patients is that their MRI may look better, yet they still struggle walking, standing, or getting out of bed. A pattern that shows up over and over again is fluctuating symptoms. Some days feel manageable, other days feel almost identical to before surgery. Number 2, adjacent segmental degeneration after fusion surgery. This is one of the biggest long-term problems that can happen after spinal fusion surgery, and many patients are never fully warned about it beforehand. During a fusion, one level of the spine is permanently locked into place, so it can no longer move normally. The problem is that the rest of the spine now has to compensate for that lost movement every single day. That means the spinal levels directly above and below the fusion start absorbing more stress, more force, and more wear and tear over time. Most people assume the surgery fixed the problem permanently, but I often see the opposite happening. The neighboring spinal levels begin breaking down faster because they are working harder to make up that fused segment. Over time, this extra mechanical stress can accelerate spinal arthritis, degenerative disc disease, joint degeneration, and even new spinal stenosis symptoms above and below the fusion itself. A pattern that often shows up is patients doing well initially after surgery, then slowly developing new burning pain, numbness, leg symptoms, stiffness, or walking intolerance all over again because of the adjacent degeneration that's developed. Number 3, spinal instability after decompression surgery. Procedures like laminectomy and decompression surgery are designed to create more space for the spinal nerves by removing bone, ligaments, and tissue that are causing compression. For many patients, this provides relief early on because the pressure on the nerves is reduced. But there's an important trade-off that many people don't fully understand before surgery. When parts of the spine are removed to open up the canal, some of the natural structural support of the lower back is removed too. In certain post-surgical spinal stenosis patients, this can create spinal instability over time. The vertebrae may begin shifting more than they should during standing, walking, or bending movements. One of the biggest frustrations I hear from patients is that they expected the surgery to stabilize the problem, yet their back starts feeling weak, unstable, or easily aggravated afterward. A pattern that often shows up is pain increasing during prolonged standing or walking because the spine is no longer tolerating load efficiently. Number 4, persistent nerve damage or nerve inflammation. One of the hardest things for patients to understand after spinal stenosis surgery is that removing pressure from the nerve does not always mean the nerve fully recovers. In many cases, the nerves were compressed for years before surgery ever happened. That prolonged compression can leave the nerves irritated, hypersensitive, or permanently damaged even after the surgery creates more space. Most people assume the pain should disappear once the compression is gone, but in practice, I often see patients continue dealing with burning pain, tingling, numbness, electric shock sensations, or leg weakness because the nerve itself is still inflamed. What surprises a lot of patients is how sensitive the nerves can remain even after surgery. Even walking, standing, or sitting can continue triggering symptoms because the nerve has essentially stayed in a constant irritated state for so long. A pattern that often shows up is patients saying the surgery helped at first, but the nerve pain never completely went away. Number 5, progressive arthritis and bone spur formation. One of the biggest misconceptions about spinal stenosis surgery is that it stops the degeneration process itself. Surgery may remove pressure from the nerves at the moment, but it does not stop the spine from continuing to age and break down over time. Arthritis in the spine can continue progressing years after surgery. The joints in the lower back may keep wearing down, the discs may continue degenerating, and the body can keep producing new bone spur growth as it tries to stabilize the spine naturally. The problem is that these bone spurs can slowly begin narrowing the spinal canal and irritating the nerves again. Many patients notice this happening gradually. The symptoms usually don't come back overnight. Walking tolerance slowly decreases, standing becomes harder, the stiffness starts returning in the lower back and legs. What surprises a lot of patients is that the original surgery may have been successful, but the degeneration process underneath it never actually stopped. Number 6, recurrent disc bulge or disc herniation. Even after surgery, the same spinal disc can become a problem again. This is especially common when the disc was already significantly weakened before the procedure. Surgery may trim or remove part of the damaged disc to remove pressure from the nerves, but the disc itself does not suddenly return to normal afterward. A lot of patients assume the disc issue permanently is gone once the surgery is finished, but in practice, I often see reoccurring disc bulges happen when the underlying spinal mechanics and movement patterns never improve. The lower back continues absorbing abnormal stress during sitting, bending, lifting, and walking. Sometimes this happens gradually over months. Other times, patients experience a sudden flare-up that feels almost identical to the pain they had before the surgery. Burning pain, leg symptoms, numbness, and nerve irritation can all start returning when that same disc level becomes aggravated and inflamed again. Number 7, weak core muscles and poor posture and ongoing mechanical stress. This is one of the most common reasons I see spinal stenosis pain return after surgery, and it's the most often overlooked. Surgery may remove pressure from the nerves, but it does not rebuild the muscles that support and stabilize the spine afterward. Many post-surgical spinal stenosis patients still have weak core muscles, weak glutes, poor posture, and unhealthy movement patterns that continue placing abnormal stress on the lower back every single day. That constant mechanical stress keeps loading the spinal joints, discs, and nerves long after the surgery is over. I often see patients who become overly inactive after surgery because they're afraid of damaging the area again. The problem is that prolonged inactivity usually leads to even more weakness, stiffness, and spinal deconditioning. A pattern that shows up again and again is a patient feeling temporary relief after surgery, but never fully rebuilding the stability their spine needs to handle everyday movement and activity long term. After hearing all of that, a lot of people start feeling discouraged because it sounds like the surgery created even more problems. But this is one of the most important parts most patients are never told. Just because spinal stenosis pain comes back after surgery does not mean you're permanently stuck that way. The patients who improve fastest usually stop thinking of surgery as the entire solution and start focusing on rebuilding the function of the spine afterward. This is a key point because once you understand what is actually driving the recurring pain, you can begin targeting the real problem instead of just chasing symptoms. This is exactly why a structured recovery approach matters, which I'll introduce in a moment, so keep watching. The goal now is reducing ongoing stress on the nerves, improving spinal support, restoring movement, and helping the spine tolerate daily activity again without constantly flaring up. Here are the 5 steps that can help stabilize your spine and reduce recurring spinal stenosis pain after surgery. Number 1, daily walking and gentle movement progression. One of the worst things many post-surgical spinal stenosis patients do after surgery is becoming overly inactive because they're afraid of damaging the spine again. The fear is understandable, especially when the pain starts returning, but prolonged inactivity usually creates even more stiffness, weakness, and nerve sensitivity over time. Gentle, consistent movement is one of the most important parts of the recovery after spinal surgery. Walking helps improve circulation to the nerves, reduces stiffness, improves spinal nutrition, and helps prevent the body from becoming more deconditioned after surgery. The patients who improve the fastest usually stop waiting for the pain to disappear before moving. Instead, they focus on controlled, gradual progression. Start with shorter walking intervals. Avoid prolonged sitting whenever possible. Multiple short walks throughout the day are often better tolerated than one long walk. Focus on upright posture and controlled movement instead of trying to push through long distances too quickly. Number 2, core and glute strengthening exercises. After stenosis surgery, many patients still have weak spinal stabilizers, weak abs, and weak glutes that are no longer supporting the lower back properly. Surgery may create more space for the nerves, but it does not automatically restore strength and stability to the muscles that protect the spine during everyday movement. Without proper muscular support, the lower back continues absorbing excessive stress during standing, walking, bending, and lifting. Over time, that ongoing mechanical stress can continue irritating the joints, discs, and nerves even after surgery. A pattern that shows up again and again is patients finally feeling better initially after surgery, but struggling when they try returning to normal activity because the spine still lacks stability underneath the surface. This is exactly why rebuilding strength matters. Focus on slow, controlled movements instead of aggressive workouts. Exercises like pelvic tilts, glute bridges, bird dogs, core bracing, sit to stand strengthening drills can help rebuild support around the spine safely over time. I also have videos on my channel showing how to perform many of these exercises safely, and I'll put links to the description below. Number 3, improve posture and reduce lumbar compression. Many stenosis patients continue standing, sitting, and walking with the same spinal mechanics that were irritating the lower back even before surgery. That means even after the procedure, the spine may still be dealing with ongoing compression and stress throughout the day. Most people don't realize how much posture affects the amount of pressure going through the lumbar spine. Prolonged standing and extension, poor sitting posture, tight hip flexors, and weak postural control can all continue aggravating the lower back and spinal nerves after surgery. I often see patients who feel relatively comfortable sitting down, but their symptoms quickly increase when they stand or walk for longer periods. That usually tells us the spine is still struggling with load and positioning during movement. This is why improving posture and movement mechanics matters so much after surgery. Focus on the neutral spine positioning, lumbar support while sitting, improving thoracic mobility, stretching tight hip flexors, and using flexion relief positions during symptom flare-ups. Number 4, reduce inflammation around the nerves with lifestyle changes. Even after surgery removes pressure from the nerves themselves can remain chemically irritated and highly sensitive. That ongoing inflammation is one of the biggest reasons many post-surgery patients continue dealing with flare-ups, burning pain, numbness, and walking intolerance long after the procedure. Many patients focus only on the structure of the spine, but the healing environment around the nerves matters too. Poor sleep, dehydration, smoking, excess sugar, processed food, stress, and overdoing activities on good days can all continue aggravating sensitive spinal nerves. I often see patients have major symptom flare-ups after trying to catch up on activity during a good day. Then they spend the next several days paying for it because the nerves become irritated all over again. This is why pacing matters so much. Prioritize sleep quality, hydration, healthy body weight, and recovery habits that can help calm inflammation instead of constantly feeding it. A clean anti-inflammatory diet can support the healing process too. Reduce processed foods, excess sugar, and highly inflammatory foods whenever possible. Focus more on whole foods, lean protein, vegetables, healthy fats, and proper hydration to create a better healing environment for the nerves. Number 5, chiropractic adjustments and conservative spinal rehabilitation. Many post-surgical spinal patients are surprised to learn that carefully modified chiropractic adjustments can still play a role in recovery after surgery. A lot of people assume chiropractic care is unsafe after a spinal procedure. That is usually because they're imagining aggressive twisting or high-force manipulation. Post-surgical treatment is very different. The goal is not aggressively adjusting the surgical area itself. In many cases, treatment focuses on improving movement and reducing stress above and below the surgery, especially throughout the lower lumbar spine. Depending on the patient and surgical history, this may involve light spinal adjustments, drop table techniques, or gentle instrument adjustments designed to improve mobility with minimal force. Once movement and joint mechanics begin improving, the next step is stabilizing the spine properly. This is where adjunctive therapies become important. Guided spinal rehabilitation exercises, postural correction, movement retraining, soft tissue therapy, and core stabilization exercises all help rebuild support around the lower back. The purpose is reducing abnormal stress on the spine, improving walking mechanics, restoring flexibility and posture, calming irritated nerves, and helping patients move more confidently again without constantly triggering flare-ups. If you've been struggling with spinal stenosis pain after surgery, you can now see how there are multiple reasons those symptoms may have returned. From scar tissue formation to nerve inflammation to ongoing spinal degeneration, surgery does not always address the long-term function and mechanics of the spine. And if your symptoms have come back after surgery, remember that you're not alone. 1 in 7 people are in your exact same shoes. The good news is you now know how important movement, spinal stability, posture, inflammation reduction, and proper rehab are for improving long-term outcomes after surgery. The surgery addressed the bone, but these 5 strategies address the foundation. It's time to stop waiting for surgery to work and start building the support your spine needs. And you should also consider looking for a chiropractor experienced with post-surgical rehab, because that may be the missing piece in helping your spine move and function better again safely. If you got value from this video, subscribe and follow my channel for more videos just like this. Share this video with someone dealing with persistent spinal stenosis pain after surgery who still feels stuck searching for answers. And the next video you should watch is this one, the 5 best exercises for lumbar spinal stenosis for quick pain relief. Many of those exercises can still be applicable for the post-surgical spine as long as you stay within your tolerance and get proper clearance from your primary healthcare provider. Go watch that video next.